Good evening. My name is Zaina Khalil, and I am a student at George Washington University in the Family Nurse Practitioner program. This is my volunteer patient, Mr. Shaw, who is allowing me to assess him for video 2 today. We're going to be taking a look at Mr. Shaw's neurological status as well as his integumentary system, his abdomen, his musculoskeletal system, as well as his peripheral vascular system. I'm going to start off with some hand sanitizer. Alright, throughout my assessment I will be looking at Mr. Shaw's demeanor, affect, mood, his speech, as well as any asymmetries, tremors, or anything like that in any of his movements. Currently Mr. Shaw seems to be a well-developed male in good hygiene. His posture is erect. He maintains eye contact throughout the exam. His skin is appropriate for his ethnicity. I'm looking at his integrity. There's no tenting noted. No beds, there's no discoloration or deformity. Cap refill is less than 3 seconds. I'm also going to be looking at his legs. No edema noted in the ankles, and cap refill is also 3 seconds in the toes. After that, we're going to be checking out your peripheral vascular system. We're going to start with the brachial arteries, 2+. While I'm here, I'm also looking for the epitrochlear lymph node. No enlargement noted. Moving down to the radial arteries, 2+. Next, the popliteal arteries. And while I'm here, I'm also feeling for the popliteal lymph node. Bilaterally, alright, 2+. Moving down the posterior tibial arteries, 2+, and the dorsalis pedis arteries are also 2+. Now I'm going to have you lay down for me so that we could do your abdominal assessment. Excellent. Alright, I'm going to have you, lift up your shirt. Thank you very much. His abdomen is symmetrical, rounded. I'm looking for pulsation of the aorta. It is visible. I'm going to have you bend your knees. We're going to look for any hernias. So bend your knees for me and lift up your neck. Yep, look, I have to see your stomach. Okay, good. Go ahead, lower your legs for me. No bulging noted, no hernia noted, and like I said, the umbilicus is midline. Now I'm going to be auscultating for the carotid and renal, femoral, and iliac arteries with the bell of my stethoscope. Okay. Excellent. I'm also going to auscultate the aorta here. Okay, the renal arteries. Iliac. And femoral. Alright, and now I'm also going to auscultate your bowel sounds before I do any palpation or percussion. Bowel sounds are active in all 4 quadrants. Now I'm going to begin to palpate for the liver margins. So we're going to start here. Alright. Okay, excellent. Liver is not enlarged. Now I'm going to palpate through all 4 quadrants. Tympany throughout. I'm going to start with some light palpation. Any pain or tenderness? Okay.
Yep.
Okay. Now I'm going to test the liver. Palpate for the liver. It's not enlarged, and then palpate for the spleen. Take a deep breath for me and exhale. Go ahead. It's not palpable. Next, we're going to try to palpate for the kidneys. pain. Okay, and kidneys are also not palpable. All right, excellent. Checking for the bladder also, just seems a little distended. Go ahead and sit up for me, thank you. While you're sitting there, also I'm again looking at the symmetry in your shoulders. They are symmetrical. Go ahead and stand up for me. Looking for the alignment is also symmetrical. The muscle mass is symmetrical. There's no dystrophy noted. Go ahead and take a few steps for me. I'm going to be assessing your gait. All right, your stride is steady, your gait is steady. All right, go ahead and then have a seat for me over there. We're going to assess for any CVA tenderness. So I'm going to have you turn around on this stool for me. Okay, excellent. And basically tell me if you have any pain. Any pain there?
No.
Excellent. While I'm here, I'm also going to begin to palpate your spine. So we'll start with the cervical spine. Any pain?
No.
Okay. And the paravertebral muscles? No deformity, no enlargement, and it is symmetrical. Okay, now we're gonna start looking at the curvature of your spine is also normal. We're gonna start with the range of motion of your shoulders. Awesome. While I'm doing that, I'm also gonna be touching here. There's no enlargement of the joints of the elbows either, or the wrists. There's no heat, warmth noted either. I'm going to have you extend your arms in front of you. Excellent. Extend them all the way up. And then I'm going to have you flex them back. Awesome. Any pain there at all when you do that? Now I'm going to have you abduct and adduct. So put your arms down by your side. Cross your arm across your chest. Excellent. Anything there? And alternate. Excellent. And then now up towards your ears and all the way back down. Excellent. Okay, now we're going to test your elbows. So I'm going to have you bend your arms towards your chest. Okay, and then extend them out. Excellent. All right, full extension and flexion. Now with your wrists, I'm going to have you just put them out in front of you. There's a natural bend in the fingers. No pain or enlargement again here. I'm going to have you also act like you're holding a bowl of soup. Excellent. Now back with your palms down, I want you to point your fingers up towards the sky and then fingers down. Excellent. Okay. Now we're going to test for your fingers. I'm palpating the metacarpal joints, and there's no heat, enlargement, or deformities in those joints. I'm going to have you grasp my finger. All right, strength is equal bilaterally. Now I'm going to have you take your palm up and move your thumb across your palm. Excellent. Now I'm going to want you to open your fingers all the way, bring them all the way together. Now palms up, flex your fingers for me and close. Excellent. And then now take your thumb and I want you to move them if you can touch all 5 fingers. Excellent. Now we're going to have you, let's look at your ankle, extend your leg, point your toes towards your face like that, yep, and then down to the ground, and then point your heel inwards and outwards. Okay, now the other side, towards your face, down to the ground, inwards and outwards. Excellent. We're going to test your knees, so I'm going to have you stand up for me and take a squat. All right, a little bit of crepitus there in your right knee. Was there any pain when you did that?
Not very little.
Okay, excellent. Now we're going to test for your hip flexors. So I'm going to have you lay back down for me on your back. Okay, I'm going to have you bend your knee up into your chest. Yep, excellent. All the way down and alternate. Excellent, all the way down. Awesome. Now I'm going to have you bend your knee again, and this time move your leg across your body. Okay, and now move it outwards away from your body. Can you move your whole leg? Okay, and then we're going to do that again on the other side. So bend, move it outward, and then inward and across. Excellent. We're going to now ask you to lay flat on your stomach so that we can check your hip that way as well. Bend your knee one leg at a time and then lift this up. Excellent. Bring that back down. We're going to switch that over, up, okay, and back down. All right, cool. We're going to have you come back to the chair so we can do your mental status exam. Okay, Mr. Shaw, could you please tell me your name and date of birth?
My name is Fuad Shah, date of birth September 11th, 1986.
Okay, and can you tell me what city we're in right now?
Washington, D.C.
And then can you tell me who the current president is?
Trump.
And the last 4 presidents?
President Barack Obama, George Bush Jr., and President Bill Clinton.
Awesome. And can you spell the word world backwards for me?
World backwards. D-L-R-O-W.
Great. Can you explain to me what an orange and an apple have in common?
They're fruit, they both have seeds, and they were grown on trees.
And what does it mean when they say the squeaky wheel gets the grease?
The squeaky wheel gets the grease. When something works hard or something keeps working, it achieves or receives benefits or something rewarding.
Okay. I'm going to ask you to, now we're going to test the rapid alternating movements. So take your hands and rapidly alternate them back and forth, hitting your knee. Exactly. Excellent. Perfect. Now your finger to your nose, and you're going to keep going back and forth. And then now switch it over the other way. Excellent. All right. Now I'm going to have you close your eyes, and then I'm going to take your hand. If you want to sit back and relax on the stool. Awesome. I'm going to take your hand. I'm going to move your finger, and you tell me whether it's moving up or down.
North, up, top, down, up, down.
All right. I'm going to try that on your toes. Okay.
Down, up, up, down.
Okay, great. Now I want you to stand and close your eyes. I'm checking the Romberg test for 30 seconds. More or less, I think. All right, no swaying noted. Let me turn this around so you got this on the test. Okay, excellent. Now I'm going to ask you to heel toe walk. So, yep. Okay. All right. Steady, symmetrical. Now I'm going to have you sit back down, and we're going to be testing some sensations. Do you want to sit back? Okay. First, we're going to start, and I want you to tell me if you feel something sharp or dull.
Sharp. Dull.
You can close your eyes.
Sharp. Dull.
And then I'm going to test your legs.
Sharp. Dull.
Okay, the other leg.
Sharp. Dull.
Okay, excellent. Now I'm going to test for the softness. So also close your eyes and tell me what you feel. Do you feel anything?
Soft. Wispy softness.
Do you feel it more or less on one arm or the other?
No, equal.
Okay. And test your legs.
Soft. Soft.
You feel it the same in both legs?
Yep.
Okay. Well, now we're going to test for some vibration. So I'm gonna have this tuning fork set, and you let me know if you, oh shoot. Test your, on your finger.
Feel by the vibrations. Feel by vibrations.
Okay, I'm gonna test your leg. Let's try that.
I feel vibrations.
Okay, thank you. Now, keeping your eyes closed, I'm going to place 2 different objects in your hand, and I would like you to tell me what they are. Close your eyes.
Coin.
Okay,
How? Screw. Long.
okay,
Tool screw.
okay. I'm going to test
Sharp.
the other hand again.
Same sharp nail. Screw. Soft. Smooth coin.
Okay, excellent. All right, and then now I'm going to be testing your deep tendon reflexes. You can open your eyes. We're going to start by testing your bicep, so just relax. Okay. Okay, and then we're going to test the tricep, so just feel like you're hanging to dry. Okay.
Mm-hmm.
Okay. Now the brachioradialis. Oh, nice. Okay. And then we're going to test your patellar. So actually, I'm going to have you sit back over here. Let me see if this will catch it. All right, sit back a little bit so that you're okay. And then, okay, relax this. Do this with your hands. Okay. And then we're going to test your for Babinski, which I hope is going to be negative.
Okay.
Okay. Sorry about that. Okay. Thank you very much. And that concludes my assessment. Thank you, Mr. Shaw.